Since the 1990s, prescription-based narcotic pain relievers such as opioids have become one of the primary reasons for drug overdose-related death in the United States. This is because the regulations and reforms placed on prescription drugs are not being specialized in the correct areas. The death toll from opioids and other related prescription-based painkillers are from 1. Commission on Combating Synthetic Opioid Trafficking Final Report by Tom Cotton, a U.S. Senator in Arkansas, a Harvard Law graduate from RAND.com. February 8th, 2022. Cumulatively, since 1999, drug overdoses have killed approximately 1 million Americans. That is a number that exceeds the number of U.S. service members who have died in battle in all wars fought by the United States. Even worse, that the United States has never experienced the level of drug overdose fatalities seen right now. In just the 12 months between June 2020 and May 2021, more than 100,000 Americans died from drug overdose, more than twice the number of U.S. traffic fatalities or gun violence deaths during that period. Some 2/3 of these traffic deaths, about 170 each day, primarily along the ages from 18 to 45, involved a synthetic opioid. The primary driver of these opioid epidemic today is illicit fentanyl, a synthetic opioid that is 50 times more potent than heroin. The rise of deaths continue to grow in hotspot zones where prescription-based medications are reaching the reach of impoverished areas, as we see in 2. Epidemiological and Geospatial Profile of the Prescription Opioid Crisis in Ohio, United States, by Andreas Hernandez, Department of Geography and Geographical Information Science at the University of Cincinnati. Nature, March 9th, 2020. Deaths by unintentional prescription opioids overdose in Ohio from 2010 to 2017 resulted in 11,790 cases. From the white population, that's 10,712, and from the black population, that's 1,078. Deaths have increased continuously from 653 in 2010 all the way up to 3,674 in 2017, with an exponential growth trend. Prescription opioid overdose mortality rates increased from 9.98 to 57.31 per 100,000 inhabitants from 2010 to 2017. The highest prescription opioid overdose mortality rates were found in the white male population, aged 30 to 34, with 131 cases per 100,000 inhabitants, followed by males that are aged 35 to 39, with 120.48 cases per 100,000 inhabitants, compared to the 57.31 cases per 100,000 inhabitants for the total population in 2017. Recent policies to oversee prescription drug use, prescription drug monitoring programs, or PDMPS, are ineffective and do not support the underlying issue of availability and widespread use of opioids. The solution is to promote more youth prevention programs. 3. Drug-Free Communities Support Program, CDC, January 22nd, 2021. The Drug-Free Communities Support Program is the nation's leading effort to mobilize communities and to prevent and reduce substance abuse among youth. Created in 1997 by the Drug-Free Communities Act, administered by the White House Office of National Drug Control Policy, and managed through the partnership between the ONDCP and the CDC, the DFC program provides grants community coalitions to strengthen the infrastructure among local partners to create and sustain a reduction in local youth substance abuse. The DFC program is aimed at mobilizing community leaders to identify and respond to the drug programs unique to their community and change local community environmental conditions tied to substance abuse. More than 700 community coalitions across the country receive funding up to $120,000 a year to strengthen collaboration among local partners and to create an infrastructure that reduces youth substance abuse. However, simply reaching out to America's youth is not a definitive solution to the opioid epidemic. There's still thousands of people dying every week. There still needs to be a safety net for those who are at high risk to overdose, such as easy access to treatment. 4. Medications to treat opioid use disorder research report, National Institute on Drug Abuse, December 2021. In 2021, an estimated 2.7 million people aged 12 or older in the United States had an opioid use disorder, or an OUD. In the past 12 months, including 23 million people prescription opioid use disorder. Overdose deaths, including prescription opioids, more than quadrupled from 1999 through 2016, followed by significant declines reported in both 2018 and 2018, and then followed by an increase in 2020. Besides overdose, consequences of the opioid crisis include a rising incidence of infants born dependent on opioids because their mothers used the substances during pregnancy. An increased spread of infectious diseases, including HIV and hepatitis C, was seen in 2015 in southern Indiana. Simply removing these drugs from prescriptions is not the solution either, nor is monitoring prescription use. If high-risk people seek out these substances, they will find them. It is clear that the opioid epidemic is not something that will go away as long as overdose education is not distributed effectively and while treatments are not easily accessible.